I was already introduced. My name is Ruben Coronel. The department where I've been working focuses on arrhythmia mechanisms. So it has nothing to do with this topic. This is quite a soft topic, as I have heard. And popped up because in the students that we have in our department, even PhD fellows, this is a problem. It's a problem to ask questions if you are in a scientific meeting, because we're talking about that scientific meeting, an international scientific meeting, where the language is English and where you have to ask a question to the speaker. So how many of you are planning to have a scientific career? None of you. Oh, okay. 1, 2, yeah, all of you. No. Yes. Okay, so then you
will have the opportunity to go to scientific meetings if you, because it's more on the engineer.
Yeah, that's okay. Well, that's not a.
There are questions related to it.
So we'll talk about this, but before we start, really, I want to show you what we will be talking about on Friday, and this is more the hardcore. Electrophysiology, and I want you to look at this very bad movie. I want you to move at this picture here, or catcher. It's an American amateur movie. If you can see the ball, it will come from here. There it is, the ball. Watch him, he's moving out of the view, but oh, there he goes. You see? And this is the problem that we were talking about mainly. In fact, that was the topic of the research that we've been involved in Amsterdam. And in fact, where the whole of lyric is aiming to resolve. It can have many origins, and we will talk about that later. But this is what you have to have in mind. So let's go back. Here, and the question is really, what is difficult about this? Why is this so? Okay. So this. Persons, what you find difficult in asking the question, if you find it difficult. I want you to be aware what the reason why you ask a question is not always evident. I want you to be aware of why you are at which place in a scientific room in the meeting. I want you to know the formalities of a scientific meeting. What are the rules? Even if they're not written down, there are rules. I want to give you a handle to start a question, because usually the start is the most difficult. Then I will give you a kind of a category of types of question that you can use when you prepare in your mind to go and ask questions. Then I want you to recognize that if you ask a question, that there may be a different meaning of that question. We'll come to that later. And I want you to know on which occasions you can ask a type of question or not. So I hope that this will help you to prepare a question and ask a question if you want. Now, you need to have a kind of a description of how a scientific meeting looks like. Has one of you ever been at a scientific meeting? You have? Yeah, you have. You? Yeah. Okay, very good. And did you ask a question? Can I ask you?
Sometimes, yes.
Yes? Okay, very good.
Usually when there's little people.
Little people. Okay. And you?
I've never asked a question.
Okay. And can you explain me why you didn't ask a question?
Maybe I felt like I was too young and experience. So
I can add another topic on this, how to use your voice, because you're very difficult to hear. And in the back, someone visited, yeah, you did.
I asked a question about the topic because it's a new field for me with the internship in conservology.
Yes.
Yeah.
And you did ask a question.
This is also the results obtained in the experiment. It's just the results obtained in the experiment.
Okay.
I don't understand how they can conclude that with that.
So if we come back to you, can you describe what the setting was of that meeting? How many people? How the room was organized? Can you describe it? Yeah.
I attend some scientific meeting, but
Can you hear him?
Yes.
and,
Try to speak louder.
yeah, I feel easier to ask a question when there is a few people, as here in the master too, because my question is important for me. But sometimes it can takes sometimes for the others, and the sum of all that is maybe not worth one question for one people. But I also know that a question of mine can be useful for some people, that this is something I don't know before.
Yeah.
So it's very.
You think it's not interesting for the other people to ask you a question?
There is more than 100 people.
Yeah.
Big cardiology congresses, for example. I never asked a question.
Okay. Well, in fact, you answered a different question than I asked. But what I want to sketch is the setting of an international scientific meeting. Usually you have a large room with 200 to 500
For
people.
example, yes.
And it's dark there, and there are a couple of microphones in the room. And then there's the podium with two chairmen and a speaker on a cathedral, right? And a microphone. That's the setting. So and usually the front row is occupied by people, experts. So Michel Hesseguer would sit in the front row. He would sit in the front row. And can you tell me in the back why you chose to sit where you are? Yeah.
The words are a bit late.
Sorry?
And the words are a bit late.
You could have chosen to sit here.
And we need someone.
Okay. Well, what I want you to be aware of, if you leave this room in 45 minutes, is that you are aware that where you are going to sit. Let's go on. So. I translated a bit to, I'm afraid that my question is not interesting for 200 other people. Is that correct?
Yeah.
Yeah. What are you afraid of if you want to ask a question? Or maybe you're not afraid.
Maybe speaking with another language, so English, maybe I could be not so fluent.
Apart from that, if it was a French meeting. Okay. Someone else? What would you be afraid of?
maybe I would be afraid that my question is not that good. And, maybe I've not understood completely the presentation. And
Okay. Are you afraid that you ask a stupid question?
yeah, very much. Yeah.
Back.
I think those two are pretty much the main ones, but
So this is a very altruistic attitude that you want to ask a question to satisfy others, right? Not yourself, but you're afraid that you're not good enough to satisfy the needs of other people. That's very friendly. And what you say is, I'm afraid to ask a stupid question. I'll tell you what I was afraid of. Question, you know, in the room with 500 people, and there is a microphone here, and there are 4 people in line waiting for their turn. And then I come to the microphone, and then I'm afraid that the person that was before me would have asked the same question. That is stupid. Because you're so concentrating on the question that you're trying to formulate, that you didn't hear the question of the person before you. That was my fear, and still is, if I'm honest. Did you have something like that?
Of course.
Gary, did you?
Yeah, what is I'm most afraid of is not to be on the top of the topic and the possibility to ask a stupid question. That's my most important fear.
Yeah. So it is mine as well. But most of the people answer in this manner. These are the fears of young people that visit a international. Afraid to ask a stupid question. That's exactly. You have not fully understood the presentation. That's what you said. And in fact, that you show ignorance by asking the question. And we already tell you that this is almost never the case. All questions are usually good. Even what you think is the most stupid question is probably a good question. This was my fear, to ask something that was, to ask something that was mentioned in the presentation, so you didn't understand the presentation very well. That was your point. Or whose was it? Yeah, you, I think. Yeah. This was mine, to ask something that was asked before. And the other thing is to be offensive. And for instance, that you're showing that you're nervous by your voice or your behavior or whatever. So these are fears. But be aware of that everybody has this. And I'll explain later that there is very rarely there's a stupid question. Now there must be reasons for asking a question. And from your what you said before, I understand that you want to be informed. If you ask a question, you want information coming your way. But there are many other reasons why you would ask a question. Can you think of something? Yeah.
just to participate, you just want to speak just to be part of the conversation.
Yeah, part of the network probably. You want to show that you're part of the network, not the old boys network in your case, but this is important. Because if you want to play a role in that network, you have to show yourself. This can be a reason to ask a question. Other reasons? Yeah.
Also, because of the politeness. I mean, if you invite some guests and you should show that you're interested in the topic, and the guest also should understand that everyone is interested in this topic and so on. So politeness.
Good point. It would be horrible if someone makes a presentation and does not receive any questions. Usually, by the way, one of the chairmen is responsible for that. So you don't have to solve that problem for him. You can be egoistic if you want to ask the question. there's no reason to be altruistic. I think, because there's no need. But okay, another reason for asking a question. Yeah.
Maybe to open up the debate and add something that was not discussed in the presentation.
Yeah. To clarify something that was not mentioned, or
Yes, for example.
Yeah.
Yes, for example, yeah.
yeah. Anything else? There are many reasons for asking questions. So this is your altruistic. You're very altruistic. If I hear this, you want to contribute to the discussion or be friendly. But there is an egoistic. You want to gain information. That's the main thing. And this is the altruistic point, to make something clear for the rest of the audience. There is an aggressive way to show that the presenter is wrong. For instance, you can ask a question. You tell me A, but we have found B. So I think you're wrong. It's a bit of aggressiveness. And you can also use it to show that you're more knowledgeable than the rest of the speaker, or maybe even the rest of the audience. There are scientific reasons, of course, to show that there is another way of looking at it, to position the paper in the light of literature. For instance, you described that a heart is beating, but this paper and this paper and this paper show that it is not true. To demonstrate the discrepancy in the reasoning of the presenter. And there's a strategic point of view to make yourself known and to be part of the network. That's your point. Now, I think you have to analyze a bit what you want to achieve with your question before you ask one. And if you do, then before you ask a question, you need to be aware of the formal issues. You see, there's a speaker usually in the corner of the room with a screen, and there are one or two chairpersons. These are very important, chairmen, because they keep the time. They should, at least, and they separate parties if there's a conflict of interest or a discussion. He or she should intervene or can intervene. And we cover this also. If there are no questions, then the chairman should provide one, or to prepare the audience to come with other questions. So the chairperson is very important, because you need to address the chairperson, not the speaker. You address the chairperson. It's like in politics, when there is a chairman of the government, the discussions always go through the chairman. Of course, this is not always reasonable, and many people address the speaker. But if there is a conflict, it is better to address the chairman, because then the aggressiveness of your question is mitigated, is reduced, if you have an aggressive. So the chairperson is important, but you have to give power to the chairman by first addressing him, to keep it short, and to not do these things. And this is what I usually are very often see in a discussion, that the person who asks a question says, I have a final question, or I have a short question, or I have a last question even. That is not for you to determine. The chairman determines whether you have a final question and whether there's another question following that, or that the question is short or long. And sometimes someone comes to the microphone and says, I have 3 questions and 1 comment. That is crazy. Of course, you can have all these things, but please restrict your question to a single point. So you must assume that if you get the word, if the chairman gives you the floor, that you can ask one question. You have the permission to ask one question, not more. Sometimes, and this is, I always have discussions about this with my students. You hear that first, before they ask a question, they give a compliment to the speaker. Thank you for this very interesting talk. Or thank you for this wonderful, and they do it every time, so there's no discrimination between the talks. It has a secondary meaning in my view, and it means that I'm kind to you. So please, if I have a very stupid question, don't be too angry with me. Be kind to me as well. It's a sign of insecurity, or it can be a sign of insecurity. So I always advise not to compliment, to start with a compliment, unless it is really a very good talk. You know, if you really mean it, of course you can give a compliment. If you want to ask questions, please do, by the way. So this is the point of how you enter a room. And it's in a way, it is a pity that we are not in the amphitheater, because that's more the setting of a scientific meeting. And probably you would have been sitting at the top, back. If you are intending to participate in a discussion, scientific discussion, sitting in the back will not help you. You have to sit in the front. Even if Michel or Piero Santos is sitting there, you can go sit next to him. There's no rule that tells you to sit in the back of the room, because you know the chairman will not see you. The speaker will not see you. They probably can't hear you. And even if you want to be actively involved, and of course, when you go to a meeting, that's what you want. You have to sit in the front, or at least in the front rows, I would say. You have to sit in front of the chairperson so that they can see you if you want to ask a question. Choose a position close to the microphone and where you can see the screen unimpeded by someone sitting in front of you. And so make it easy for yourself to ask a question. Because if you're sitting in the back and waving your hand to the chairman, that won't help you. And so if you're in the back of the room, you may as well not ask a question, because you're in a disadvantage to all the others. And you know, Michel Hezeguet and Piero Santos and Olivier Bernus and David, they will ask questions before you have a chance to speak. So, starting a question is the most difficult. First words are important. And, you know, I always say something, the first sentence is lost anyway, because the audience has to get acquainted to your voice, your accent, and you have to get acquainted to the microphone. So why don't you say something without any content? Like, my name is Ruben Coronel and I'm from the Academic Medical Center in Amsterdam. Won't hurt. I mean, it's always good to introduce yourself. And then the second sentence, you start with your question. And the question starts with this: why, how, what, when. So if you're not sure how to start, this is how to start. The more experienced you are, you will first, if you're more experienced, you will give an introduction, a short introduction. We have shown this and this and this and this and this, and then follows the question. Why did you? And then the empty sentence is involved in that introduction. But this introduction should be very brief. And now some words on the question why. If you use why did you study, or why does arrhythmia start with a T wave, negative T wave? That can be interpreted in two ways. To what purpose? And what was the cause? So why is a difficult question. It is not unequivocal. So you cannot use it, the why question, but you can use it if you want to give the speaker a bit of space to, because then he can choose. Why is the universe expanding? You can interpret it to what purpose is the universe expanding and what is the cause of the universe expanding. And if you ask the question why, then you give the presenter some freedom to interpret the question to his whatever he likes. So you must be aware that why is not always a good question. Now, then there are some advices, and maybe you can come up with others, how not to start with it, with a question. Many people start with, I missed it, but maybe I missed it, but maybe this is a stupid question. And then, it means that you think you're stupid, or that the speaker has not explained well enough. So it has a secondary meaning in my opinion. So I don't use this. Maybe this is a stupid question. The same is maybe I missed it. Would probably mean to say that you didn't mention it. Of course, you haven't missed it because you were paying attention. Probably you mean to say, if you use that the speaker has not mentioned it at all. And this is the old point again of giving compliments. Very good talk. If you give and then the question, it can mean that you are superior or consider yourself superior to the speaker because you are in a position to judge. Or, as we discussed before, it can be a plea to be kind. Maybe I ask a stupid question, so please be kind to me and don't kill me in public. See?
Unless you are a very recognized expert in the field.
Yes, of course, if you're...
It will be received as a compliment.
Exactly.
If the questions confirm
a stupid question that he will use. And if he says this, or if Dr. Los Santos says this, then it really means something. You can go home and be proud, probably. Now, a stupid question, you can use a trick. And I use this, put exactly in the question. If your question is, what is an action potential? That may be conceived as a stupid question in a certain group. But if you say, what exactly is an action potential? Then the bird by simply putting in exactly. What exactly is a spoon? Well, if I ask you that, you will probably explain it to a lot of detail, what a spoon is. And well, the main thing is, if you ask a question, be brief, short as possible. Not too short, because then they haven't heard you. So you put in the first sentence without meaning, then a very brief question. That's the best thing to do, in my opinion. Okay. Any comments, remarks, disagreements? You don't have to agree with me all. Anyway, what I want to give you is a classification of questions so that you can mentally prepare for it. I've made a classification of 5 types of questions. And of course, there are many other classifications possible. But let's go through it, and you can replace it with your own classification. But this will give you a classification that goes from simple to complex. Not necessarily bad to good, but the complexity increases. Class 1 questions I define as the request for information. What was the type of tirade solution that you used to perfuse the hearts? 2 is a question about the internal consistency of the talk. You can try to find inconsistencies within the talk, and you want to have that resolved. 3 is a question about the inconsistency with your own work. I have shown that tirade should contain sucrose. You didn't. Why? Why is that? Then there's the consistency with the world, so with literature. You can say, for instance, Hirsch et al. Have shown that the perfusion fluid should contain sucrose. And so you refer to the literature. And then the last question is the eagle's eye question, where you say, so what? That's confrontational. If you ask a person to explain what the significance of it is. Why would you do this? You know Maurits Alessi? Yeah. He
Likes that.
He likes that. It's horrible. Anyway, what I told before, the complexity of the questions increases, but this is just as good a question as that. So this is going from 1 to 5 again, with examples of the type of questions that you can encounter. What was the concentration of the drug use? How did you cannulate the artery, etc., etc. So you ask for information. This is the type 2 for internal consistency. In figure 2, you showed that X is true, but in figure 5, you showed that Y is true. How do you explain that inconsistency? So you don't have to have any knowledge for that. You can simply derive the question from the presentation. You conclude that X is true, but the difference is not statistically significant. So how can you say that it is true? This is external consistency. Related to the experience of the person who asked the question. In figure 2, you showed that X is true, but I have shown before, or we have shown before, our group has shown before that Y is true. For instance, do you know what M cells are? Has this been discussed? No? No M cells. Well, I think Olivier Bernus will talk about it. It's a special type of cell in the middle, hence M, the middle of the wall of the left ventricle, and a lot of problems were attributed to problems with these M cells. I had a fierce discussion with someone, and this was the question that always popped up. You show M cells, but I haven't. What is true? Well, we spoke about this. Now you relate to the literature. In this case, you relate to Dr. Klatzis. I don't know whether he exists, but he or she exists. And this is the so what question of Maurits Alessi. What is the relevance of your results in the light of literature or eternity or so what? But, you know, I want you also to be aware that each question has a connotation, a secondary meaning. And this is exactly where you have been afraid of. And I'm sure you are aware of it already. For instance, class 1 questions can have the secondary meaning, I've not been paying attention or I'm ignorant. That can be conceived as such. The second class, the class 2 questions point out a discrepancy in the presentation itself of the presenter. And if you ask then a question about the inconsistency, it means I'm smart, but you're not. And if you compare it to your own work, it may mean I'm better than you. If you relate it to the literature, it may mean I know the literature better than you. And if you use the Alessi question, then it may mean I have an eagle's eye view of the whole field, and I'm able to judge whether it is relevant or not. So that makes it difficult to choose what kind of question you want to ask. And it depends a bit on the setting. If you have a very big room, 500 people with Pierre dos Santos sitting in front, then probably you don't want to ask this question or this question. If you're young and a starting scientist, you probably need to be somewhere in the middle ranges. If you're in a work meeting, so in a setting like this, then any question is okay. In fact, this would be a very good question if you're in a work meeting. Why the hell did you do this experiment? That's a very good question, but probably not in a big scientific meeting. Okay? And then there are a kind of a series of questions that I would not ask. And these are a couple of examples. Why didn't you make a mouse model? You can ask that question for any subject. There's nothing original about it. Why didn't you use CRISPR-Cas? Well, everybody's doing CRISPR-Cas. And what do you want to reach with this question? Why didn't you do an immuno-co-precipitation? And if you ask this kind of question, it may mean that you want to say, I know a lot of complex techniques, and you don't. And I've heard this one as well. It was from one of the supervisors in our group. What would you do to bring this study to Nature? Come on. And this particular supervisor has not published in Nature. So if you ask this question, it suggests that you publish in Nature every week, which is very expensive. I think it's $12,000 to publish it. But anyway, so I would not use these. And this I've said before. Oh, in work meetings, everything is good. There are no stupid questions. even if you ask what is an action potential, then it's still a good question. In international meetings, I think you have to ask yourself how you are part of that network and if you want to be part of that network. Because if you want to be part of the network, you have to make yourself known by asking questions to start with. Or to present, of course, but then you have to be invited. Consider the connotations, the secondary meetings, and ask yourself, do they know you? For instance, have you published in the field? And if you have, refer to it, then they know you, see? So, in an international meeting, I would restrict myself to question class 2, 3, and 4, and preferably not 1 and 5, if you were in the start of your field. And the older you get and more experienced, you're going to this question and this question. See? Okay. Now, this final, I think we are at 45 minutes, so this is the end of the Dutch lecture window, but we'll continue a bit more to be more French in this case. I will give you a very short presentation, 2 minutes, by Wolfgang Amadeus Mozart. And I want you to prepare questions and ask them, and afterwards you'll all have a turn to asking questions. And what I want to do is the person sitting next to you will classify 1, 2, 3, 4, 5, what kind of a question it was, okay? So prepare yourself. If you want to sit more in the front, be my guest. So I will give you this talk. My name is Wolfgang Amadeus Mozart. I'm from Vienna, and my talk is about classical music and the inducibility of arrhythmias. So the background of this study is that old people, 80 years old and older, they like classical music. And we hypothesized that listening to classical music is antiarrhythmic because they don't die, these people. We therefore tested the influence of classical music in the catheterization lab during VT catheter ablations. Okay? So what we did is we included 725 patients with VTs. This took us 16 years. We randomized these patients to classical music or heavy metal in the catheterization room. You know, these people are awake, so they could hear either classical music or heavy metal. We used standard catheterization techniques. The operator was blinded, not really, but he had a headphone with white noise on it, so he was not aware of what kind of music was being played. And then we tried to induce arrhythmias in these patients by pacing from the right ventricular apex with up to 4 premature stimuli. And then we looked at the number of arrhythmias that were induced. These were the results. Randomization worked because 360 patients, there's a typo there. 360 patients received classical music, a Mozart piano concerto, and 365 patients heard Metallica. There was no difference between the groups in infarct size and location. Male and females were the same. Complications rate were similar. Interesting, there was deafness in 2% of patients. The follow-up was uneventful, and the important thing is that inducibility was significantly higher in the classical music group than in the Metallica group, 25 versus 21%. The conclusions of this study is that, contrary to expectations, classical music is detrimental for the inducibility of ventricular arrhythmias. Thank you, Mr. President and Mr. Chairman. I'm happy to answer questions. I'm the speaker.
I can start if you want.
Sorry,
I can start.
you're the chairman.
First question. I am the chairman.
Okay.
So there's no question in the audience?
Yes. What concerto nerve is introduced to for this?
Sorry, I don't hear you.
They use a concerto from Mozart, which one?
I still don't hear you.
Which concerto of most
Yeah. Okay, what kind of question is that?
An information.
Yeah, class one, yeah, very good. I'm not going to answer the question. Yes, oh, I'm sorry, he's the chairman, so.
Is there another question? Yes, please.
Hi, I'm Leah Benabou from Olivec.
Very good.
I was wondering why you chose to specify with 4 extra stimuli, because maybe in the literature we see that it's not the most specific.
Oh, okay, yeah. What kind of question was that?
That was a fourth type.
Yeah, because we invoke literature.
Yeah.
Maybe I have to.
Very good. Yeah,
Is there another question in the audience?
yeah.
Hello, I'm Ewan from the Lyric Institute.
Yeah.
What's the point of
didn't really remember, but it is more like 2 or 3.
Yeah, fine, I think, so what? It's the so what question. Yeah.
Two questions, but it's because it is so. This question was, cynic. He asked for the
Internal consistency. This one, huh? So we say it could also be a class 2 question.
Yeah, because if we look as it's simple question, it's a 5 question, but the way you say it, it's more like a critique of the presentation, I think.
Yeah. But the so what question is can can mean a kind of criticism. Yeah, that's why I say don't ask this question if you're at the beginning of your career.
Hello, I'm Pierre Gravinet from Olivec. One could argue that the volume level might take part in the induction of an arrhythmia. Do we know if there are different volume levels between the 2 groups?
Yeah, what kind of a question is that? Difficult to classify.
Classify maybe 1, but maybe if you can just the literature or the study field, maybe the study.
Just the study.
Yeah,
My
yeah.
question was on the study.
And you point to an internal inconsistency because the volume level is not being recorded, which is quite stupid. So it's a very good question. Yeah. Okay.
Hi, Pierre dos Santos, I have a little question. Do you have any idea on the mechanism by which music could interfere with minority towards arrhythmias?
Then you start with I have a little question. I advise my students against it. If you say it, then I say, okay. Yeah. What kind of a question was that?
5, like.
Yeah, I think so, yeah. Yeah, I agree. More? Is everybody has its turn? Did you ask a question? Yes, yes.
So hello, I'm Mehdi. I have a question. So do you think that the patient number is enough that have been studied, it's enough to have significant conclusion?
What kind of a question is that? There's nobody sitting next to me. Yeah, it's true. It's a good question, by the way. Nobody has asked the question how it comes, what the explanation is that the classical music is detrimental. Okay, did you ask a question? I don't remember.
No, I did.
Oh, you didn't? Okay.
So my name is Andrei Belut from Lyric. Did you check some musical preferences of the patient before?
Yeah. Yeah. What's that? Yeah, I think so, yeah. Yeah. Okay. Right. So let's wrap it up. Any comments or questions or points for discussion? Yeah.
Can I ask you, because you said it's not good to start from complimentary and generally don't use this.
Yeah.
But if, for example, you just say thank you for your talk or something, is it the same? How do you think? Or
Well, this is not a rule. This is my
but
advice.
how do you think? If you say just thank you, not like a perfect talk or something.
No, yeah, I think it was okay. Yeah, but you have to, in that, I always end up with discussions with students about this point, giving compliments or not. It's difficult. I think you have to follow your intuition there. But you have to be aware that it can have a secondary